Welcome to Reducing Healthcare Costs, Tools, Strategies, and Patient Assistance. This is a part of a series of health access, advocacy, and policy webinars put on by the Hemophilia Council of California. Today, our presenters, Mandy Herbert from Patient Services Incorporated and Kim Eisenberg from the Hemophilia Federation of America, will be going over different tools and strategies that you can use to reduce your healthcare costs and considerations and programs that may change in 2020 and beyond so that you can figure out the best strategy for paying for your care. I'd like to give a big thank you to our 2019 webinar series sponsors, Takeda and Sanofi Genzyme. And with that, I will turn it over to Mandy Herbert from PSI.
I'm happy to have the opportunity to share with you today a little bit of information about our Premium Assistance Program. So currently we have what we call our Inherited and Acquired Factor Deficiency Premium Assistance Program. We've actually administered a program for the bleeding disorders community for 30 years. That's actually one of our first programs, and we've been in existence for 30 years. It was last August, or this past August, so it's hard to believe that amount of time has passed. But within this program, I put together a little chart just to help patients understand what is offered. So the assistance type that we offer is premium assistance, so support for your health insurance premium. The insurance types eligible to apply are both private or commercial and public insurance. And then the diagnoses covered within the program range from hemophilia, von Willebrand's, thrombocythemia. You can see all the different diagnoses covered within the program here. The federal poverty level that we use to determine financial need for the program is set at 350% FPL. And to give you an idea of that range, what that looks like, that for two dependents, whether you're in like a low or high income state, could range anywhere from $59,000 to $89,000. The review time frame, so to kind of backtrack here, once you're approved for support within the program, patients can receive financial support for 3 consecutive years before they rotate off of assistance. And they have to rotate off of assistance for 1 year before reapplying in the event they still need that financial support. But we do have a review time frame where we're going to go ahead every 2 years and just make sure that patients on service still meet the eligibility criteria. So we're going to look at your household income, make sure nothing has changed with insurance, things like that. And then the maximum annual assistance amount per year, per patient, would be $11,000 in premium support. And then we usually like to break down public versus private or commercial insurance types. So I won't go through all of these, but you can see that under public insurance types, we consider all forms of Medicare, Medicaid to be private, veterans, and then if you look on the private insurance type side, you'll see group coverage, coverage to the marketplace, individual, COBRA, open enrollment. Those are all what we consider private or commercial insurance types. And again, public and private insured patients are eligible to apply for support through this program. So usually we have the question asked, what kind of documentation is needed in order to determine if a patient is eligible for support within the program? So once we receive a referral on your behalf or you apply on your own for assistance, we will reach out to you to ask for proof of household income, and that can be your most recent 1040 tax form, 2 consecutive pay stubs, a Social Security letter, or W-2 forms. We're going to ask for a signed medical care provider statement. We will provide you with that statement, and it's a document that is used to confirm your diagnosis and is signed by your patient, or excuse me, by your physician. And then the last documentation that is needed is proof of insurance, and that's upon approval. So we're required to assist with premium amounts. So in order for us to provide you with premium support, we will need to have proof of insurance in that situation. And applying for assistance, you can do that online. So you can visit our website, and we have that hyperlink here. You can create a secure patient portal account. And then once you've created that account, you can log in and complete the application in less than 10 minutes. It is very user-friendly, but if at any point in time you're going through that process and have questions, please do not hesitate to reach out to us. We're happy to help. And to give you an idea of the process flow, so from the point of application to the point of approval and receiving support. So a patient or a caregiver can apply through the online patient portal. And then once we receive that referral or patient application online, or again, if we can take it by phone if that's an option as well. We will determine from there, is the patient eligible for assistance based on what we gathered through the application. If they are not, they will receive a denial or inactive letter. If they are eligible, we're going to send them an introduction letter saying, welcome to PSI, in order to determine if you will receive financial support. Please send in this required documentation. And that letter will actually outline what documents are required. After 14 days, if we do not receive that, we will send a reminder to say, hey, just a reminder, we need this information to determine if you're eligible. And if you are, and pass that on to us, we're going to determine your eligibility. So if you're not eligible, we are going to let you know through a letter that's mailed to your attention. And then if you are, we're going to send you an approval letter to say, welcome to the program. This is the amount of support that you will be provided going forward. And then premium payment options. So how can we help pay that premium? What methods are we using for payment? So we can mail a check directly to your insurance company. We can reimburse you following proof of premium payment. We have a credit card payment option. So that is a secure payment card. It's loaded monthly with the proper premium amount, and it can only be used to make payments for that approved payment amount for your premium. The other option we have is electronic deposit for reimbursement patients. So funds are deposited to your bank account, and this is available for patients seeking reimbursement for eligible payment. And these are just FAQs that PSI tends to receive from the community. How long does it take to be approved? This is a question that is always on your mind. So as soon as we get that required eligibility documentation, so household income, proof of diagnosis through the medical care provider statement, we can go ahead and process your application within 2 days, and that's really at this time. So of course, in the first quarter of each year, it may take a little bit longer with changes in coverage, but generally it's pretty quick, a pretty quick turnaround time. And how much assistance will I receive if approved? I had mentioned prior $11,000 per year, but if we break that down to a monthly amount, it's $916.67 per month. And then how often will I need to reapply for assistance? So in this case, any changes in your income or insurance, they should be reported to PSI as soon as you are aware of them. If you don't have any changes in household income, we're going to request information to determine if you are still eligible for support through the program every 2 years. And I had mentioned that earlier on. And then is there anything else that I need to do to receive assistance? So to ensure that we are assisting with the correct premium amount, PSI does require a copy of your health insurance invoice every 6 months. And that's just to make sure that we are indeed paying the proper premium amount. We have had cases in the past where it's changed, and we just want to make sure that we're providing support the best way possible for the patients who are on the program. I do want to mention our PSI Access program. They are actually a group of attorneys. They're based in Tampa, Florida. Their services are free of charge. And in regards to the bleeding disorders community and a couple other different disease areas, this team helps patients apply for Social Security and disability. They will even go represent you in person. I will say the national average success rate, I think, is around between 34 and 36% right now. But we were fortunate that our access team had an 83% success rate just this past year. So they've done a really great job of taking care of patients in this area. And then we also have a legal hotline. The legal hotline, anybody with a chronic illness can call into. So you have questions about COBRA, you have questions about obtaining or continuing health insurance, workers' comp, our staff are there to help you with those questions and to help you just navigate and better understand those areas. So I've included the access number and then our legal hotline number for you as well. Thank you, Robin.
Thank you so much for joining us. And just as a reminder, this webinar is part of a series of educational presentations by the Hemophilia Council of California and all of our wonderful volunteer presenters who carve out time out of their days to help us. And thank you again to our 2019 series sponsors, Takeda and Sanofi Genzyme. Thank you so much for joining us today.